Depression is a serious illness. It affects millions of people around the world. It's more than just feeling sad or down. It's a real medical condition that changes how your brain works. These changes make it hard to feel happy, even when good things happen. Many people experience depression at some point in their lives. It can happen after a difficult event, like losing a loved one, but sometimes it happens for no clear reason. Depression is not a sign of weakness. It doesn't mean you're not trying hard enough. It's important to remember that depression is treatable. With the right help, people can and do recover. It's crucial to understand that feeling down sometimes is normal. Everyone experiences sadness, but when these feelings last for a long time and start to affect your daily life, it might be depression. Depression can manifest in different ways. It's not always obvious. Someone with depression might not always seem sad, but there are some common signs to look out for. One of the main signs is losing interest in things you used to enjoy. For example, if you loved playing the guitar but now it doesn't appeal to you, that could be a sign. Other signs include changes in appetite or sleep. You might feel constantly tired or have trouble sleeping. Some people eat more when they're depressed, while others lose their appetite. Depression can also make it hard to concentrate. You might feel forgetful or unable to focus on tasks. This can affect work, school, or even simple conversations. Finally, depression can lead to feelings of worthlessness or guilt. You might have negative thoughts about yourself or feel hopeless about the future. Scientists believe that depression is linked to changes in the brain. While the exact cause is still being researched, we know that brain chemistry plays a role. Imagine your brain has tiny messengers that send signals. These messengers are called neurotransmitters. They help regulate your mood, sleep, and appetite. In people with depression, these messengers might not be working properly. For example, serotonin is a neurotransmitter that affects happiness. Low levels of serotonin have been linked to depression. Additionally, stress and trauma can affect the brain's structure and function. Prolonged stress can shrink the hippocampus, a part of the brain important for memory and learning. Genetics can also play a role. If someone in your family has depression, you might be more likely to experience it too. However, genes don't tell the whole story. Environment and lifestyle choices also influence your risk. Section 4. Seeking help and diagnosis. Getting a diagnosis for depression can be challenging because there are no physical tests. You can't just get a blood test or X-ray. Instead, doctors rely on your experiences and symptoms to make a diagnosis. The first step is talking to a doctor or mental health professional. They will ask you about your symptoms, how long you've been feeling this way, and if you have any family history of depression. Be open and honest with your doctor. The more information they have, the better they can understand what you're going through. They might ask you to fill out questionnaires about your mood and habits. Remember, there's no shame in seeking help. It's a sign of strength and self-care. Getting a diagnosis is the first step towards recovery. It's also important to remember that you don't have to go through this alone. Reach out to trusted friends or family members. Let them know what you're experiencing and that you need their support.